How commonly are HIV and hepatitis C virus infection diagnosed simultaneously? In such cases, what are the key clinical considerations in recommending whether to initiate treatment for either or both diseases?
Currently, when a patient is infected with HIV and enters into care, the recommendations are that all individuals with HIV be screened for hepatitis C. As a result, it's not uncommon that you're finding out about hepatitis C in a newly diagnosed HIV patient. Sometimes they may have known about one or the other before, but oftentimes these are both relatively new diagnoses, at least in someone who's newly diagnosed with HIV. So then you've got this patient who's co-infected, and you've got to look at the priorities. I think the priority that we've seen emerge quite clearly is that HIV treatment makes sense. So I think the first priority is to prepare that patient to take antiretroviral therapy. That's based on evidence that antiretroviral therapy, regardless of CD4, may actually help improve liver disease and prevent a progression of liver fibrosis. So in other words, the antiretrovirals help the Hep C too. The other piece of information that I like to know at the time of diagnosis is the liver disease stage. And I would equate the liver disease stage to the CD4 cell count. So you've got this new patient, you've got HIV, you've got hepatitis C. For HIV, you want to know the CD4. It tells you their prognosis. For hepatitis C, you want to know the fibrosis stage. So I think increasingly we'll be recommending those patients have things like elastography or FibroScan done to measure the liver damage. That then allows you to prioritize, after starting antiretroviral therapy, where to go with hepatitis C treatment. Now, in some patients, depending on what regimen you plan to use for hepatitis C, you might want to reverse that. Let's say the patient has cirrhosis for hep C, you might reverse it and treat the hep C first. But as a general rule of thumb, most patients should go on ARVs first, followed by hep C treatment at some later date, driven by their fibrosis stage.